And mind you, up until this point, you know, you're simply doing your client's triangle of conflict, triangle of person, and you're getting data from them from like what you see, what you hear, and you're plugging them into the triangles. And when you have enough information, you kind of present a formulation, but you present it as a suggestion. You just say, like, hey, I've been listening to you, and it seems like, you know, you're pulling back from this adaptive affect, and you're blocking it with these defenses. And it seems like you learned that from your mother, but it's playing out today with your boss and with your partner. And then you ask, is that right? Is that correct? And, you know, sometimes, because this can be really hard for a client to listen to because you're seeing them so clearly, you know, you might want to just explain that an affect phobia is a learned reaction and it can be unlearned. And you always want to be asking for collaboration. Is this true? What's missing? You know, while you're doing this, your therapist stance is very, very important. You want to be collaborative. You want to be thoughtful. You want to be focused. You want to be curious. And you want to be empathetic. It's important that your client feels seen by you, but also seen, you know, with empathy, with understanding, with care, with love. Because, you know, they're doing a courageous thing by opening up to you and sharing themselves with you. And it's a real honor to be, you know, in the presence of someone who is being so open. And it's important that you respect them and demonstrate respect over and over again so that they can have a sense that you're trustworthy. And you also want to be ready to regulate anxiety, because formulation can raise anxiety and emotional pain. You know, when you begin to share your narrative, to share your formulation with your client, you're letting them know how much you see them, but you're also reminding them of a lot of pains that have happened in their life, because it's painful to have an affect phobia. It really impacts your life in a negative way. That's why you come to therapy. And so realize that formulation is anxiety provoking, and it brings up a lot of pain. And so you want to be ready to regulate anxiety, to offer like a soothing support and comfort, and to just help your client be able to increase their awareness of themselves, and to help them be able to see how they, you know, work with themselves and work with others. And always remember that this is like an exposure desensitization model. So we only offer what our client can bear, then we pull back, we regulate anxiety until they get more comfortable again, we ask permission, and then we go forward again. And so, you know, I've added in this slide to use psychoeducation and share examples, because I think sometimes when you're doing formulation, it's really helpful for your clients to receive psychoeducation, to understand like what is an affect phobia, and to also hear about examples that aren't related to their lives but are related to maybe other people's lives that are outside the session, because it's important to normalize. I mean, the fact is all of us have affect phobias, and you know, some of us unfortunately really have to work through them and to engage in therapy in order to do that. And it's nice to know that we're not alone, that other people are also in the same situation. And, you know, essentially when you're formulating, you're painting a picture. At least that's how I see it. It's like I'm looking at my client's triangle of conflict, the triangle of person, and my job is to paint a picture so that they can see it. So I might be pointing out their defenses and mirroring their defenses so that they can see it, so they can increase their awareness. I might be identifying the adaptive feelings, and I'd be focusing on the adaptive feelings that they have access to, and before I even start looking at the affect phobias. So I might say to someone, wow, you know, you have a really wonderful way of being compassionate with yourself and being compassionate with others. But it just seems like when it gets to the emotion of anger that it becomes very difficult for you. And so, you know, I'm helping them see their inhibitory affects, how they might, you know, pull back from an adaptive affect with guilt or shame or anxiety. And then I'm helping them begin to identify their affect phobia, that perhaps they pull back with from anger with shame, and they use self-attack. And that shame and that self-attack prevents them from really being able to access their emotion of anger and being able to experience it and express it in a way that's helpful. And then with the triangle person, I'm trying to help them understand where the phobia came from. You know, who did it originate with, and how is it being maintained in their present life? Because it's important to be able to see how it's operating today. Because a lot of times you can start with beginning to resolve how it's operating today, and then move to the past, or you go just the opposite. You resolve what happened in the past, and then you're able to resolve what's happening in the present. It really depends on the person and their history. So right now, we're just going to pay a little bit more attention to defenses and inhibitory affect and adaptive affects. We've done this in past webinars, but there's a little bit of a twist to it today, because we're talking about how to share it with your client, how to paint the picture, how to help them see their inhibitory affects, their defenses, the affects they have access to, the affects that they avoid, and like where it originates from and how it plays out today with current people in their lives, as well as you as the therapist. And so, you know, just a reminder that APT categorizes defenses as maladaptive feelings, behaviors, and thoughts. We do see that defenses can be very, very helpful. You know, it's just sometimes when someone has an affect phobia, it can be very unhelpful. And so we also look at symptoms and Axis 1 and Axis 2 diagnoses, and we try to keep in mind that defenses are deployed when inhibitory affects become too much. And so, you know, oftentimes inhibitory affects can turn into a defensive affect. You know, anxiety can be inhibitory. It can also be defensive. Guilt can be inhibitory. It can also be defensive. Shame can be inhibitory. It can also be defensive. The same with disgust. The same with emotional pain. It's all about how high. And this is a good moment for me to remind you that inhibitory affects pull back. Defenses block. And so if you're sitting across from someone and they're saying, I'm anxious, I'm anxious, I'm anxious, I'm anxious, I'm anxious, that's a block. It's a defense. Because you can't get a word edgewise. There's no connections that's happening between you and the other person. Whereas if you're sitting across from them and you're seeing them begin to wring their hands, you're seeing like maybe they're starting to move around in their body, to shift, you know, that's more of signs of they're experiencing inhibitory affect in their body. So you really have to become an expert between what's inhibitory affects and what's defensive. And that comes from watching videos and just practicing formulation and practicing your triangles. It just comes with time. And so here's a new slide that I want to share with you. And it's all about how to look for defenses. And so you've asked your client to describe a specific example. And then you want to carefully listen, watch, and pay attention to your instincts as your patient describes a specific example. Do you hear or see or feel that something's maladaptive, destructive, dysfunctional, or hurtful? That's a defense. Do you hear, see, or feel that there's avoidance? Defense. Do you hear, see, or feel something odd, quirky, not typical? Defense. Do you hear or feel that something is off, doesn't seem right? Defense. And so if you're sitting across from someone, you're listening to them, you're watching them, you're paying attention to your gut instincts, and you're able to decipher what's yours and what's theirs. And if things are coming up and it's like that's maladaptive, that's destructive, you know, one thing that I'll pay attention to is the person able to be in connection with me, right? And if they're not in connection with me, they're usually in a defense, you know. And so you want to be listening, hearing, and even feeling to get a sense of what a defense is in a room, and that's really important. And then with formulation, you're going to be sharing it with your client if they can bear it. And so here's just another triangle for us to look at. And, you know, a lot of times in session, we'll see people with rapid speaking, smiling when talking about something sad, avoiding eye contact, changing the subject abruptly, somatic preoccupations, self-attack, intellectualization. They're all defenses. And so the art becomes, how can you point out to someone that they are talking fast or they are smiling when they're talking about something sad? And how do you do that in a way that causes them to feel like you're there to help them and to support them? You're not there to judge them or to cause them to feel bad about themselves, because there's a lot of shame that's under the surface with defenses, and your job is to not activate that shame, or, because it will be activated, to be able to regulate the shame when it comes up. And just remember, like, how hard it is when someone points something out about you and you're just not really ready to see it yet, or you don't feel comfortable with the person who points that out. Right away, defenses go up, and you want to push the person away and have nothing to do with them. And the same thing happens with their clients, but the difference is that they're in our office and they really want to get help. That's why they're there. It's just they need someone who has the ability to show them what's going on and help them see it for themselves so they can become more aware. So you want to be pointing out to a client when you see a defense, but you have to gauge how comfortable they are. You don't want to be like defense, 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 particularly if you don't have a relationship. You want to, sometimes wait, get to know them, and look for openings that you can point out a defense, and then expect that anxiety is going to rise and that you're going to have to regulate anxiety, and we'll say more about that in a few minutes. And then you want to be able to look at your client's reaction together. And so you might say, did you notice that when I pointed out that you were avoiding eye contact, that you got really anxious? And can we look at that together? What was happening there? And so the two of you talk about it together, and then you ask, when you're ready to go back to the work, you just say, is it okay if we continue this process? And hopefully they'll say yes. And so here's just a quick example, and just so you know, in the manual, there's a lot of wonderful examples that you can go to. There's just too many to fit into a webinar. But I strongly recommend that you use those examples, and maybe you get together with your peers and start practicing with role plays. But here the therapist says, you just lowered your head when I pointed out how you smile when you're talking about something sad. Is that hard for you to hear? ? You see, there's no assumption there. It's just a behavioral observation. I see that you did that when I said this. Is that hard for you to hear ? The patient says, yes, it's hard when someone pays attention to me. So, of course, if they're not used to that, and if it causes them to feel uncomfortable, they're going to be showing some defensive behaviors. But you as the therapist, because you're there to help regulate anxiety, you're going to say, what is the hardest part right now? Let's just slow down until you feel more comfortable with this process. And again, this is exposure and desensitization. You're going to have moments where people are exposed to feelings that they feel uncomfortable with, but you're not going to barrel through. You're going to pull back, you're going to regulate anxiety, and then you're going to move forward when they feel comfortable again. I mean, essentially, the idea is you're trying to help your client get more comfortable with feelings, and the way we do it is by working at their own pace, checking in with them, being collaborative, and asking for permission. And it's just amazing that if you keep that in mind, when things get harder in the treatment, a lot of times your clients will give you the go to go ahead and push, when normally you might have had to pull back and wait a little bit. And so you're really learning how to work together, to work in unison. It's a true art form. So now let's go to adaptive affect here. And just a reminder, sometimes a client is conscious of their affect phobia, and sometimes they're unconscious. And you have to keep that in mind because there's a really big difference. And so you're working on the formulation, you're working on the triangle of conflict, the triangle of person, how they link together. But when you're looking at adaptive affect and what's being avoided, you want to be asking yourself, what is your client not feeling or doing that could be helpful to resolve their problem? You know, what underlying feeling will motivate action that is helpful or will resolve their problem? Keep in mind that adaptive affects are connected to adaptive behaviors. And when someone has an affect phobia, they're losing access to those adaptive behaviors. And so, you know, while we're always trying to help people experience their affects and to be able to express them, and that feels wonderful when that happens, we know that it automatically enables them to activate all these positive behaviors that are really useful to them outside. And so, you know, just an example of an avoided affect is when someone's not crying and when they're sad. They lose all that physiological relief that comes with crying, you know, or that ability to reach out to other people after a good cry. When someone's not speaking up when they're angry. When they're not reaching out when feeling loving, they're pulling themselves back. When they're not soothing themselves when agitated. You know, when someone isn't able to connect with the behaviors associated with a feeling, they lose an awful lot of what gives a human being relief in life. And we're trying to change that. And so, you know, these are the big four feelings from Lee McCullough and her group. And I'm just going to go through this quickly because we've studied this in other webinars. But here's also a list of the affects, adaptive affects that Lee has in her books. And it's anger, assertion, sadness, grief, fear and terror, enjoyment, joy, interest, excitement, closeness, tenderness, positive feelings toward the self, and sexual desire. So you're looking for, you know, whether or not your patient is blocked to one of these adaptive affects. And if they are blocked, how are they pulling back with an inhibitory affect, and how are they blocking it with defenses? That's the question. So here are some of their primary process emotions. And this comes from Jack Pangsup's work, and we've been really integrating his work into APT. And you can see that there's a lot of overlaps with Lee McCullough's. So here's one example. This is actually a really easy example, but it felt like it's very clear to share with you today. So the therapist says, if you were to be true to yourself and you were to let go of the anxiety and obsession around getting a raise, what would you be doing? Okay, so the question is like, if you're not being anxious, if you're not being obsessed, what would you be doing? And the patient says, I'd be talking to my boss and asking for that raise. And I mean, all of us can relate to that. And the therapist says, well, let's see if we can make that happen for you. Well, there's a reason why the person isn't doing that. And a lot of times that comes from the past. And so you have to kind of go back in time and find out, where did the anger phobia originate from? Who did it start with? And can we work through it to resolve it? And in future webinars, we're going to be talking more about affect restructuring, defense restructuring, and really discussing like how to resolve an affect phobia. Today is just about our formulation. It's about how to talk about it with our clients so that we can be true collaborators working together. So here we are with inhibitory affect. And just as a reminder, you know, inhibitory affects cause someone to pull away from an adaptive affect. If their inhibitory affect becomes too high, uncomfortable, then defenses are deployed. And a lot of times those defenses allow a person to not feel the discomfort of anxiety, guilt, shame, pain, disgust. And so, you know, also what happens is the inhibitory affect's high, the defenses are deployed, and then that's where the affect phobia comes in, and it's completely blocked. Okay, and so, you know, guilt, anxiety, shame, pain, disgust is another one. And I like to think of it as if you get a cup of coffee and the milk is curdled and you go to drink it and you can smell it and you just pull back with like disgust, like, ugh, and you cringe. And then you want to get it away from you. You might throw it in the trash can or drop it because it's just so disgusting. Well, the disgust is causing you to pull back from the coffee or the curdled milk in the coffee. And then the action of throwing the cup away is the defense. And so that's exactly what happens with internal phobias, is people have this extreme pullback, and then they have a defense that kicks in. And so, you know, in order to do anxiety regulation, it's considered graded exposure, and you're really helping someone confront the feared stimulus, in this case a feeling, in a stepwise fashion. And so we're not pushing people through to experience an affect that they're avoidant of. We're actually trying to work with them, trying to understand about the fear, and trying to help build the courage in order to move toward the affect again. And you do this over and over and over and over again until you get through. And if it doesn't work, that's usually when you call your supervisor and you say, I need some help. Because there's a lot of reasons why it won't work, you know, and so you know, all of us need support, whether it's through our colleagues or our teachers or our supervisors, to find out when something isn't working. And these are classic examples of anxiety regulating. What's the hardest, scariest, worst, or most painful? You know, what are you experiencing in your body right now? You know, exploration of sensations a lot of times is a gateway to affect. So someone has anxiety, they explore the sensations in their body, and they gateway into affect. I've found a lot of times if someone's really anxiety, just encouraging them to look into my eyes, even though that might activate another phobic reaction to closeness, sometimes it's very grounding for someone to just be able to look into my eyes, and then I just say in a soothing voice, just tell me what's the hardest right now, tell me what's the worst right now. And then you want to be asking, you know, if they have felt this way before, and when, and with whom. So in summary, there's just a few things to keep in mind with formulation, is that it's a working hypothesis. You know, you're just simply, you know, painting a picture of someone's triangle of conflict, their triangle of person, you're linking them together, and you're asking them, is this right or is this wrong? Because it's going to focus treatment. So you want to get a sense, are we going to be working with the anger phobia? Are we working with the sadness phobia? Are we working with the closeness phobia? And if so, are we able to identify how they pull back from those affects with inhibitory affect, and how they block it with defenses? And it's important to remember that it doesn't have to be perfect or right. It's really the collaboration that's key here. It's like you working with someone to help them increase their awareness of who they are and what they do. And in this case, you know, their inhibitory affects, their defenses, what affects they have access to, what affects they're avoiding, their triangle of person, and you're a part of a team just helping them begin to see their affect phobia, and in the meanwhile gain motivation to work through the affect phobia, because once the affect phobia is identified, then you have a treatment plan. Okay, we're going to help them access anger. We're going to help them access rage. We're going to help them access closeness. And the key here is formulation is about collaboration, and it's a wonderful way to motivate people and get them focused. And you'll see them really working outside of sessions, which is key to healing, once they have a sense of what you know, their formulation is. So there are a lot of potential pitfalls, and unfortunately, sometimes the pitfalls depend on the day. You know, sometimes we have bad days, and, you know, sometimes we might feel very strict or judgmental, and sometimes that can really impact, you know, how we're doing a formulation. And so just always be careful of your own stress level and to how you might be bringing that into the session and how that might be impacting your formulation. When I'm having a bad day, I always tell myself to just try and be relaxed and to do more collaboration and more listening. And I'm looking for a way to just get myself to calm down so that I'm not jumping to conclusions, and so that I'm really in collaboration with someone. So, you know, listening is the number one key. Collaborating is probably the number two. And so you always want to be compassionate and supportive, because the process can be quite painful. And you want to go at your client's pace, and keep in mind that this is exposure and desensitization. A lot of you CBT therapists out there, will understand APT very quickly and how to do it because you've had a lot of exposure to exposure and desensitization. And one thing to be prepared for is that when you are doing really wonderful collaboration with your client, and there's a lot happening with the formulation, people begin to access memories, and sometimes they're not memories that they've accessed before or that they feel comfortable with, and then panic can come in, and they can feel quite overwhelmed. And so, you have to be relaxed and be collaborative and work together. At the same time, you have to be ready for when those painful memories emerge, and to just really be a calming force and to just support someone and help them understand that, it's here for a reason, that they're probably ready to look at it, and that you're going to be there with them, and you're going to figure out, what's happening. There's been many, many, many times that I have seen that a person with an affect phobia hasn't allowed themselves to experience the affect that they've been avoiding because it's linked to a trauma memory. And another thing that I've discovered is usually the trauma memories aren't as awful as they feel. So it's like if we're able to regulate anxiety together around the trauma memory, then we're able to look at the trauma memory, together and see it from a different lens. And so, again, that's another reason why to be empathetic and supportive. So, another thing to keep in mind is reformulate, reformulate, reformulate. Formulations shift during treatment. They'll shift in one session. You're always refining them or revising them. And as you get to know someone and they access more information, new material will be uncovered, and it will come into your client's awareness. And so, a lot of times it isn't until like toward the end of treatment that you really have an idea of like what the true affect phobias were. You start out at the beginning, let's say that there's 4 or 5 of them that you're working with, and you realize at the end, wow, there were only really 2. But the 4 or 5 played a huge role in getting to the 2. And so, there's layers and layers sometimes of affect phobia, and, the stronger the working relationship and the more you just work on collaborating and painting the picture of the triangle of conflict and the triangle of person, the more helpful it is for your client to really find out what's happening for them. And so, this has actually been like the hardest webinar for me to pull together because it's very difficult to talk about formulation, particularly without video to show it. And so I want to recommend that you reread chapters 1 through 4 and do all the exercises from start to finish. And then you can go to the website and get the triangle forms, do your own triangles, and start creating your own formulations. It's a real safe way to start practicing formulation. And just so you know, this is how I learned. I completed all the exercises. I did my own triangles, but also try to practice with friends, family, and colleagues. There's a lot of times people are willing to learn about affect phobias and to look at their own, and you can see if you can practice doing a formulation for them. But if you have a chance to get your colleagues together, and even if it's for like an hour and a half or so, and maybe you can do some of the exercises from the book, that's going to be really, really helpful. So just to end, I want to point out one of my references, and that is by Bruce Perry, The Boy Who Was Raised as a Dog, and Other Stories from a Psychiatrist's Notebook, What Traumatized Children Can Teach Us About Loss, Love, and Healing. This book has been the most useful to me with formulation because it gives you a really good understanding of childhood trauma and where affect phobias originate from and how to work through them. And so I strongly recommend that you get this book. It's an easy read. It's really fun. And it's going to be very helpful to you with doing formulations. And then other than that, the best thing that you could do is to try to see as many videos as you possibly can, and participate with workshops, and probably get APA videos. We've done a lot of work with APA videos. So thank you so much for this webinar. Our next one's on December 12th. And I'm going to start fielding some questions, and we're probably going to go over some other questions when we meet again, because this is definitely a hard task for us to tackle within 1 hour. And so just 2 more questions. Let's see, helpful to hear how inhibiting affect can become, or should we say functions as a defense when experienced at an extreme level. Yeah, I find this fascinating, and I'll never forget the day that it finally clicked for me, and I really understood what Lee McCullough said, where any affect can be on any pole of the triangle, she would say. And so, inhibiting affects, we tend to grade them, and a lot of us learned APT through research, and so we're able to say that's 10% anxiety, 20%, 30, 40, 50, 60, and it goes on up. So let's say if the anxiety is around 70 upward, that means the person's experiencing a lot of discomfort, with guilt or shame, anxiety, and when that discomfort gets too high, it'll go into a defense. And sometimes the defenses are inhibitory affects. And, we do see with panic attacks that's high anxiety, and then the panic is the defense. But we're talking more about like guilt as a defense, shame as a defense. The best way for me to describe it is if someone's experiencing shame, anxiety, guilt, any of the inhibiting affects as a defense, you're not able to connect with them, and they're not able to connect with themselves. And so there's a very panicky feel to it all. Or with guilt, there's a lot of self-attack, or with shame, a lot of self-attack. And so you really have to be asking yourself, is the person able to connect with themselves? Are they able to connect with me? If they aren't, think of it as a defense. And we can talk about that more in other webinars. And so here's one more question, and then we'll wrap up. Does the client's learning in the sessions carry over to everyday life? Absolutely. Or does it need to be encouraged in terms of homework? We do both. But, when someone accesses an affect that they have been blocked from, you're going to see the positive change with the behaviors, and that just happens. But we do a lot of homework assignments to help people working outside the session, and sometimes it's to prepare them for being able to access affects that they have been blocked with. And so I do a lot of homework assignments, a lot of connecting my clients with outside people, and that's a huge part of my treatment. And I think one of the reasons why it goes so well is people take responsibilities for themselves. So see you on December 12th. Thank you so much for coming to this webinar, and I hope it's helpful this week with your work with clients. And I'll see you later. Bye-bye.